Hello everyone, I'm Dr. Lori Langdon, a board-certified pediatrician, mother of 6 and grandmother to 2 now, yay, who would love to tell you today about how safe and effective the newly approved COVID-19 vaccine is for children ages 5 to 11. So you'll remember last week, 10/26/21, the Vaccine and Related Biological Products Advisory Committee met and advised the FDA to give full approval to this Pfizer product. They did, and then it went to the Advisory Committee for Immunization Practices and the CDC, who have completely approved this. So it is literally available today. Today is November the 3rd, 2021, and pediatricians all over the country are both excited for this product, but also a little nervous about getting it out there because, you know, there can be some tricky parts to the logistics. So I would love to quickly answer a few of the most commonly asked questions that we receive. This product is made by Pfizer, the same company that makes the adult product that was originally 16 and above from the beginning and then got the additional emergency use authorization for 12 and above. Now, for the children 5 to 11, it is only a 10 microgram dose, so that's 1/3 of the adult product. It is also given in 2 sessions, the second 21 days after the first, ideally. And the studies have proven both that it is safe. The side effects typically are worse after the second dose, just like with older folks. They are less likely, though, to have fever and chills, but most of the time, the more likely side effects would be injection site pain, redness, or swelling, pain being the most common. They can have some body aches and joint aches, but again, fever and chills are less likely. Also, it was demonstrated to be effective. 90.7% was what I read as far as effectiveness against actually catching the COVID virus. And so we're just really excited because this helps families hopefully be able to protect every member of their family so that upcoming holiday plans are really looking more promising this year. It makes me excited since some areas have not upheld the mask mandate as directed by the CDC. And so at least this way your own individual children can get some active protection for themselves in the form of antibodies against the virus. So that's exciting. So some commonly asked questions we get. What if my child is almost 12? Should I wait until they turn 12 and get the higher dose? The answer to that is no, you shouldn't wait. Our goal is to get everyone vaccinated as soon as possible. Now, also, please remember to have some grace with your pediatrician's office. As mentioned, the logistics can be tricky, but as soon as it is available, we would encourage you to get your children vaccinated, even if they have a soon upcoming 12th birthday. Other questions that persist are similar to some adult questions, such as, will this messenger RNA vaccine cause problems in the future? No, we don't believe so. Look at the millions that have already been vaccinated in the 12 and up population with no long-term problems. We know the virus itself can cause long-term problems, and 7 to 8% of children can get this long-haul COVID with prolonged fatigue, joint pains, and things like that. So we don't see that with the vaccine, only with the actual virus. We have seen no cases of myocarditis in this age group. There have been concerns with messenger RNA vaccines and myocarditis, but remember, first of all, they were microscopic concerns. 887 cases, I think, out of 100 million doses, something like that. It was a ridiculously tiny fraction of the concern. And the vaccine-related episodes of myocarditis were only very mild, self-resolved, no medication, extremely mild, and nowhere near the incident that the cases of myocarditis are, especially in adolescent males, with the actual COVID virus itself. So remember, the vaccine is always going to be safer than the actual virus. That's the whole point of this, of course. The other recurring question I get is, but what if this could impair or alter or somehow harm my children's future fertility? That is not a thing, it turns out. That was one of those specific items of disinformation that was deliberately spread by anti-vaxxers on the internet, and it continues to worry a lot of people. Some people have been concerned because they have noticed some menstrual irregularities in teens after their COVID vaccine, and we believe that's just because their entire immune system was activated and then that somehow interfered with that. That in no way predicts or indicates that there's going to be any issues with fertility. Many thousands of people have become pregnant after receiving their COVID vaccine. In fact, some people did in the very original trials who had sworn not to and who were supposed to be taking measures not to, but accidentally got pregnant. So it certainly does not impair fertility. So I hope I can reassure you about that. We would strongly, as pediatricians, recommend that your children ages 5 to 11 receive their vaccine. We also acknowledge that pediatricians are often your best source for individual information for your specific child. So please ask them for guidance if you have very specific questions about your child and any recent illnesses or any high-risk conditions. Almost always, if your child does have some underlying issues such as asthma that could make them at more risk for the real virus, we would even more strongly encourage you to get them vaccinated. So I hope this has been helpful and encouraging to you, because it is to me and to most pediatricians, that we could look at a future with fewer cases and more protection for school-aged children. So I really encourage you to get your children vaccinated, but again, always speak to your own pediatrician about that. Thanks.